Hi, my name is Catherine Highland, and I'm going to be talking a little bit about COVID-19. So COVID-19, the definition, CO stands for corona, the VI stands for virus, D stands for disease, and 19 is just the year that it was found, 2019. Pathogenesis of COVID-19. So we have our two little scarecrows here, and this one is infected with COVID and this one is not. This one can either cough, sneeze, they can sing, they can scream, etc. Whatever it is to get respiratory droplets into the air. They can have a breathing treatment, and then this little scarecrow develops them, just breathes them in, or they get on her lips or anything like that, and then the virus attaches to her cells and penetrates her cells, and now she is infected. So epidemiology of COVID-19, so far in the US there have been about 12 million cases, there's been about 255,000 total deaths. Worldwide there's been 55.6 million deaths and about 55.6 million cases and 1.34 million deaths. Morphology of COVID-19, the virus particle ranges in size from 70 to 90 nanometers, it's obviously not this big, and surface viral protein spike, membrane, and envelope of coronavirus are embedded in host membrane-derived lipid bilayers, which encapsulate helical nucleocapsid, compromising viral RNA. So this is the viral RNA, this is the envelope, and nucleocapsid protein. Laboratory testing is done with a nose swab run on a Sophia machine for my hospital. The machine takes about 15 minutes to run. There's also antibody testing, which can be done 2 to 3 weeks after you've been infected with the virus. Incubation period is 14 days with a mean of being 4 to 5 days. Initial presentation is fever, cough, tiredness, shortness of breath, flu-like symptoms, loss of taste or smell. Course of the virus is different for everyone. For some, they're asymptomatic, some are only sick for a day, and others have been sick since March. Recovery and long-term sequelae. Recovery often takes 1 to 2 weeks for a healthy individual, but those with comorbid conditions, recovery can take longer, and lasting complications can arrive like fatigue, there can be organ damage, shortness of breath, we've seen systemic inflammatory infections, memory problems or sleep problems, blood clots, and blood vessel problems. Treatments, we've got antiviral medications like remdesivir. Those reduce the ability of the virus to multiply and spread through the body. Steroids, which reduce an overactive immune system. And convalescent plasma therapy, which we use the blood from those who have fought off COVID, the antibodies, and those who are very sick, we use that blood. So COVID-19 has affected me as a nurse student. I wasn't able to have a regular graduation in May, and then as a nurse practitioner student, it has been difficult to find clinical placements. And as a nurse, it has been bad in the ER trying to tell patients that they can only have one visitor. And I think COVID-19 will affect me as a future nurse practitioner, but there will be more telehealth visits because people will be afraid of coming to the doctor. That is it. Thank you.